Remember when one of the biggest right-wing talking points about Obamacare was the death spiral?
The exchanges don't work, and you wind up going into what they call sort of the insurance death spiral.
What did you call it, death spiral?
Insurance death spiral, yes.
Scary.
Obamacare is going toward a death spiral.
This is that death spiral.
A death spiral.
The death spiral.
A death spiral.
What's called an insurance death spiral.
You get into what they call that death spiral.
This could be the beginning of the death spiral. It could potentially be the beginning of the death spiral.
The architect of Obamacare being interviewed by Megyn Kelly, she asked him, is this the beginning of the so-called death spiral?
Is that the beginning of the so-called death spiral?
And he said, quote, that could be the beginning of a death spiral, unquote.
That could be the beginning of a death spiral.
That's the death spiral.
Now, the idea back then, I'm sorry, I'm laughing. That was really brilliantly done, editing room. The idea back then was that a broken website would mean only the old and sick would bother to enroll, and without younger enrollees to balance out the risk, the Obamacare exchanges would enter into an actuarial death spiral. The whole thing would be doomed.
We have not just Obamacare unraveling, not just the Obama administration unraveling, not just the Democratic majority in the Senate, but we could be looking at the collapse of American liberalism. Obamacare is the big thing for them.
Is that true?
Answer, not true. Here's what actual enrollments look like, according to ACAsignups.net. With less than 2 weeks remaining before the March 31st deadline for 2014 enrollment, signups continue to spike. This graph includes enrollments through the exchanges, plus the Medicaid expansion, plus people under 26 years old staying on their parents' coverage. But an important subset of that, healthcare exchange enrollments, passed the 5 million mark yesterday, according to the Centers for Medicare and Medicaid Services. And so the revised goal of 6 million signups appears to be within reach. Also in line with the CBO's projection, by the way. But whether or not it does hit the 6 million mark by the end of the month, health industry insiders say Obamacare has cleared the bar, with the caveat that real examination will come on a state-by-state level. Health benefits consultants agree with President Obama's assessment this week that enough Americans have signed up to private health plans under the Affordable Care Act that it will work. Joining me now, Avik Roy, opinion editor at Forbes, author of How Medicaid Fails the Poor; Jonathan Cohn, senior editor for New Republic, author of Sick, The Untold Story of America's Healthcare Crisis and the People Who Paid the Price. All right, Avik, you have been someone who has been very critical of the ACA from the beginning, but also very cautious about pronouncements of impending death spirals. So do you feel vindicated?
Yeah, I mean, in fairness, Chris, a lot of liberals were also worried about the so-called death spiral, and they were always wrong. Both sides, both the conservatives who were cheering it on and liberals who were scared about it, because the subsidies do provide a cushion that prevent a true death spiral from occurring. And at the end of the day, it's important to remember that we can't use the sign-up figure that CMS is talking about as actual enrollments, because if you aren't actually enrolled with actual health coverage when you go to the doctor or the hospital, unless you've actually paid the premium. That's number one. Number two, it depends on whether you've been previously insured or previously uninsured. And a lot of the people, according to the surveys we've seen, who've signed up for Obamacare on the exchanges were previously insured. And only a minority, about 15% were previously uninsured.
Jonathan, what's your response to that? I've been hearing a lot from conservatives about this payment issue, right? That essentially CMS is hiding the ball on whether folks that have been signed up have actually paid. Is that true they're hiding the ball? How important is that to the long-term health of the project of the ACA?
Well, Avik is right that there's a lot we still don't know, and frankly, we won't know for many months. It's just the nature of these things, that data takes a while to gather. I don't think CMS is hiding the ball. I think we just don't know. But look, I think this has also been exaggerated in the same way those death spiral quotes you played were exaggerated. If you talk to the insurance industry, they are saying, yes, not everybody is paying up, but it's about 8 in 10, about 80%, and maybe that will even come up over time. And, we don't know what the actual decline in number of people without insurance is, but it does appear there's circumstantial evidence, not hard proof, but circumstantial evidence that we are starting to take a bite out of the uninsured and more people are getting coverage. So, the signs are reasonably good. I think Avik is right to be cautious. It's always good to be cautious. We should have been cautious before, and we should be cautious now. But a little bit of optimism seems in order.
Did you think they were going to hit this number? I mean, even the 5 million. Forget if they get to 6 million. I mean, in the dark days, and it does seem to me like all the Zach Galifianakis, LeBron James, the gifs on the White House website, that all of this, whether it seems goofy or not to folks that seem to be critical of it, they seem to know what they're doing in terms of pushing enrollment, getting these numbers up.
Right. I mean, look, things looked really. Oh,
please,
sorry,
John,
go ahead. Things looked really bad for a while, and I was, I certainly had my doubts. And I sort of thought, when the website was having so many problems, if you had told me they'd get to 2 million, 3 million, and there'd be big problems, I would have said, yeah, that seems possible. It wouldn't collapse, but there'd be big problems. Things, after they got the website together, they actually things started to work more or less like they're supposed to be working. So, that's another reason to be very cautiously optimistic.
So, Avik, we're on national television, so that you have permanent record and all. It's March of 2014. What are when we talk about the Affordable Care Act a year from now, what are your predictions? What do you think is going to happen in this first year in which we've actually got people signed up for insurance?
Yeah, I think what's going to be interesting to see is what the insurers charge next year for health insurance, because even the for-profit insurers who were very cautious about what the risk pool would look like, who actually predicted that there would be a skew towards older and sicker enrollees, they've actually been surprised to some degree by the amount of sicker and older enrollees in the pool because of some of the changes the White House has made on the fly, because of the grandfathering provisions, things like that. So it's going to be interesting to see how much that's going to cost next year. The numbers we're hearing are maybe 15% higher than what the prices were in year one. So that's going to be something to focus on. But I do think that people are going to sign up eventually, particularly the people who are eligible for the subsidies and the people who benefit in terms of having pre-existing conditions, being sicker. And I do think the law is not going to get repealed. I do think it's here to stay. And I think actually a lot of Republicans believe that too, even though they're not willing to admit it on the record.
Jonathan, there is one example. There's one precedent here, which of course is Massachusetts. And in Massachusetts, I recall that the percentage of folks uninsured, it didn't go away immediately. It was a kind of progression over time as the patchwork of the law kind of came into place, as the exchange got set up. Is that what you expect to see? Because when we were talking about, I remember when we were, fighting on this bill when I was covering in Washington, 45 million Americans without health insurance, and now it's, we're down quite a bit from that. So the question is, what's the path from here to there?
No, that's exactly right. This was always going to be a slow process. Even the Congressional Budget Office estimates, they didn't say everyone was going to get insurance right away. They said it would be incremental year after year. And actually, even when fully implemented, as you know, there would still be a lot of people without health insurance. But progress would be slow, and the kinks would get worked out. And I think if you sort of watch what happened in Massachusetts, you say, okay, I get it. This takes some time. Yeah. There's going to be some bumps along the way, but eventually you get to a better place.
That is the open question. And Avik, you sound like it sounds to me like the law is here to stay. The debate is going to shift at a certain point about what to do about the law or how to fix it or how to alter it. But I hope that others come along to that view as well. Avik Roy from Forbes and Jonathan Cohn from The New Republic. Thank you both. That is all in for this evening. The Rachel Maddow Show starts right now. Good evening, Rachel.
Good evening, Chris. Thanks, Ben.